A 40-year-old man presents with 3-month history of dull, aching, and daily headaches and peripheral vision loss. He also has erectile dysfunction and loss of libido. Exam shows bitemporal gynecomastia and bitemporal hymenopsia. Serum lab test results show high prolactin levels. MRI reveals a 1.3 centimeter pituitary macroadenoma. Cabergoline therapy is prescribed. Which of the following changes are most likely to occur in the first few weeks following initiation of therapy? Now, this patient is presenting with signs of prolactinoma, and we know that because he has high prolactin levels as well as a pituitary mass. Now, let's go over why the patient is experiencing erectile dysfunction and loss of libido. Now, these symptoms are going to arise because prolactin is going to inhibit the hypothalamus from secreting GnRH. Now, as you know, GnRH is going to be responsible for the secretion of FSH and LH, and we're ultimately going to produce testosterone with the effects of LH. So, if we have a decrease in the levels of FSH and LH, then we're going to have signs of low testosterone levels, which can include loss of libido as well as erectile dysfunction. Now, this patient also has bitemporal hymenopia, which is going to be due to the fact that this mass is compressing the optic chiasm. So, on the lateral visual fields, he's not able to see anything, or he has a decrease in vision. So, these are going to be what I'm drawing in red is going to be what he's not able to see. And the reason for this is because, as you can see, these fibers are going to cross over at the optic chiasm. And so if we have a mass that is compressing the optic chiasm, then these fibers are not going to be able to do the function of what it's supposed to be doing. So as a result, we're going to have a loss of vision. Now let's go over why this patient was giving cabergoline, which is a dopamine agonist. Now, cabergoline is a dopamine agonist which was given to reduce the size of the mass as well as reduce the levels of prolactin because dopamine has an inhibitory effect on prolactin. So as a result, we can decrease levels of prolactin, which will improve some of the symptoms that the patient is experiencing. And the reduction in the size of the mass will also help the patient's vision because now it won't be able to compress the optic chiasm like it was doing. So the answer to this question is going to be answer choice A, which is going to be a decrease in serum prolactin levels, an improvement in erectile dysfunction, as well as an improvement in the visual field effect due to the reduction of the mass.